Now, the doctors' strike has stretched over 40 days now with no end in sight. The government and doctors' union have failed to reach an agreement, and now the Kenya Conference of Catholic Bishops has offered to mediate and bring the stalemate to an end. Joining me now in studio is Bishop Anthony Muheria, the Bishop of Kitui Diocese. Thank you, Bishop, for joining me.
Yes,
now, of course, we see the bishops coming in to try and intervene in this situation.
yes.
More specifically, how do they seek to mediate the stalemate?
Well, first, and put it in context, obviously we are very concerned about the losses of life that we have experienced in the country, and especially during this Christmas period. And we feel that the bleeding of the country needs an immediate, at least we need to stop that trend and downtrend, especially in terms of the poor who are dying. And so the bishops came up with this idea of since we are not contesting the merits or the demerits of the doctors' strike, we are saying we really do need to attend to our dying Kenyans. We really they shouldn't pay their lives, even though there may be worthwhile demands from the doctors. So the bishops have offered, if the doctors are willing to come on board and the government, to sit down and see what first an agreement that will let them go back to attend to these dying patients while the process of agreement and negotiation is going on. Because what we feel is that just a stalemate, a standoff between the two, it's really the doctors, we've always admired them. They're such great, and the health workers in terms of the service they provide to our people and the selflessness with which they work. So we are really appealing not so much to the legal or the law, but to the heart, saying they have been given such a ministry and stewardship that is so key and important to Kenya and to the life of so many, that would wish to find a way whereby, while seeking what they look for, we can still be able to attend to the sick and the dying. And the Catholic Church is willing to come and hear both sides and see, is there any way we can reach a compromise?
So from where you sit, where do you see the parties, where have they gone wrong in terms of this negotiation process?
On the technical side, it's very difficult to say this is where the things went wrong. But on we as bishops obviously look a little bit on the ethical first. And on both sides there are ethical issues. On one side there are the ethical issues of holding us all ransom and using the lives of these dying people as the bargaining weapon for their demands. And on the other, that the government should also listen, because the doctors are such a key player in our country. Our lives are in their hands, so we really should listen. And so it's a standoff where both sides are not bulging. It is a standoff where it's either everything or nothing. And we really believe that there is a way of meeting somewhere in the middle.
In the statement, Bishop Anyolo had said the county government should create an environment for dialogue. Do you see the counties as hardline in terms of how they're approaching the doctors' union?
I don't think so. I think there has been an openness, a bit of an openness, that possibly we could sit and talk. But so far in the public and in the press statement that have been made, it's been very, very hardline on both. But we do believe that amongst the doctors there has been a feeling of more heart of saying, yes, we realize what you're saying, maybe we can talk, but we also want to have our demands looked into. But I feel that it's a place where the leaders and the unionists are maybe holding too tight, and really they are also doctors, and they really should feel that we are not appealing not to legal, not to the big things of saying whether you should get it or not. It's just, let's first get the biggest stalemate is not the stalemate between the government and the doctors. The biggest stalemate is, as they are referring to this, a noose in our necks, is the people who are hung, who are dying, and their blood is on our hands.
And the doctors have been accused of being greedy and selfish because you're not speaking to their humanity and telling them, have a heart. You know, if you could come back and deal with at least the emergency situations, they're not budging in that sense. So, I mean, would you agree with that sentiment?
I think in general, in Kenya, there is a lot of movement towards greed and very individualistic kind of feelings in our professions. we feel very much as if the professions were my own terrain and no one else should go there. What they are really an invitation to a service to the society. I think it is a phenomenon we've noticed across the board in all professions. Everyone wants more money and to work less. And I think it's a moment here to call into our conscience and to think back and say, really, yes, we need a better pay. There is no doubt about that. But surely there is a midway, there is a balance, and not everything is money. Amongst the doctors, the greatest esteem we have for them is more than any pay that they get. When I hear a doctor coming in, I say, I really look at him with respect.
Right.
I hear of a nurse, I give her all the due respect. There is a lot more that you get paid than just the money.
Right.
But I think there's a virus of greed that has swept across our country, and we notice it in all areas. So I don't think it would be fair just to accuse the doctors of that over greediness. I think we start off with our own legislators. We go down the. It's a virus that is catching up with everybody. I wish we could be able to contain it and become more human, and also a little bit more concerned about service that is not only lip service, but a real service that is selfless for the people, whichever profession that we may find ourselves in.
And we're seeing the doctors make an attempt to explain their side. They're releasing a document that basically is detailing their CBA. We'll put a graphic up for our viewers to also take a look, an early look at it before it is published in the papers. But they're looking at 6 main points in the CBA. One being better equipped hospitals, second being sufficient health staff, the third being adequate compensation, fourth being merit-based promotion, the fifth being postings and transfers by a national body, and the sixth being standardized disciplinary procedures. What do you make of those?
I think one of the things that I would certainly feel with is the fact that we need more doctors. That there is no doubt.
Right.
Even looking at the WHO standards, the ratio, I think it was 2.5 doctors to 1,000 is a given. And I think in Kenya it will be something like 0.25, 0.3. So it's true we're way down, and mainly the doctors are overworked. I think that is true. But again, we should educate more of our children. We should have more people going to medical school. We should train them better, but increase the number of enrollment. So I think there are reasons there, and I think they do have a point. The amount of the salary that they receive, I think it's a demand that is worth looking into. How much is really the question that we're speaking about. Now, the other issues about merit promotion, that really is about the system. And since I'm not in the system, I really cannot speak much. But just as we have said the issues that have to do with greed and also corruption, perhaps they are alluding to that. I really don't know the details of what has happened in terms of how the promotions have done. So the technicality of that conversation, of that agreement, will have to be looked by the technical people. But as a fast reaction, I would say there are reasons and there are merit-worthy issues that need to be addressed. Now, the issue is how much and what do we use as a bargaining weapon or our bargaining terms. So that's all we are really, as bishops, are saying. We can look at it.
So they're on the right track, but they need to find a compromise.
We have to find a way where we sit. Dialogue is a main issue that the bishops are speaking about. Too many of the issues we have right now are not being sorted out at the dialogue level, and I think we should start doing more of that.